Hi again, this is Mike Jensen with the Tri Radio Solutions podcast, steering the ship, and that's navigating the choppy waters of research and development. I'll be here again today with my co-host, Leo Dodds. And if you remember our first episode, we talked about history of CAPA, and then we kind of teased that in this episode, we're going to dive a little bit deeper into the first half, of the kind of 5 steps to consider. As always, feedback is welcome, and I will turn it over to my esteemed co-host, Leo Dodds, to kick it off.
Thanks, Mike. So last time when we were doing that intro and overview of CAPA, I went through the 5 steps. And if you recall from that episode, we were talking about the 5 steps of CAPA, and the secret behind it was doing the 5 steps in order. So you got to do them in order, and then you get a pretty decent CAPA on the other end of it, right? And so those 5 steps were the problem statement, the investigation, and then within the investigation, the root cause analysis. Then you get to the CAPA plan, and finally you wrap it up with an effectiveness check. So those are the 5 steps in order. And what we want to focus on today, we'll break it up. And so this episode, we're going to talk about the first part of that, which is the problem statement, the investigation, and within that, the root cause analysis, and we'll stop it for there. So those 3 things bundled together are really what one would almost consider the deviation investigation part of the process before you get to fixing anything. And sometimes when you undertake your investigation and your root cause analysis, or RCA, we'll throw that acronym probably, you might find that there's no CAPA to do. So we'll cover that as we go through, but we're going to take those first 3 pieces of CAPA, problem statement, investigation, and root cause analysis in order, and go into those in a little more detail today.
Sounds like a great plan.
All right. So the first step in our 5-step process is the problem statement. And sometimes that's called the description of the problem. And as I mentioned in the last episode, these are really about describing objectively what broke. And if you can do that concisely and succinctly, what it does is it frames out what you're going to investigate and helps you to organize and focus your investigation. But it also tells you what you're not going to investigate. So if your problem statement is vague or poorly worded, you might then start considering a lot of other possibilities without zeroing in on the real problem that you're going to try to get to the root cause of. So it's really, that's the whole purpose of being concise and focused and getting into specifics in the description of the problem, so that you can bound and put boundaries on what that investigation is going to be. That's why we're doing it that way. And so a good problem statement should be robust and measurable and fact-based and free of opinions. I don't want to know about, what you think about, et cetera. It should be concise. It should be all of those things. But one thing it shouldn't do is tell me why it broke. I don't want to know that we have this problem because Mike was sleeping on the job, right? I do not want to hear that at this point. I only want to hear, when it happened, where it happened, who was involved, what process was taking place, what machine I was using, or all of those things are really objective descriptors of what happened. And so they belong in the problem statement. But why it happened, or whether I think something is likely, has no place here. Does that make sense?
Yeah, no, that makes sense. Imagine it helps reduce the noise around it if you really focus the problem statement. You get distracted by kind of artificial noise around the problem.
So I may blame you a lot, Mike, but I will not blame you in the problem statement.
Good to know. I swear I wasn't sleeping. My eyes were just closed.
And, I also, I think you probably gathered as well. I don't want to get vague statements that could lead to other arms of an investigation that I don't want to consider. So I want to stay away from being vague. And I definitely don't want to be offering a solution to the problem. So I'm going to give you, maybe this is a good time to do this. Why don't I give you an example of a really concise problem statement so that you could start to think about how you would begin to organize your investigation, right? So I'll give you a GCP example because I'm more of a GCP guy. So try this one out for size. So on January 21st at site 101, the monitor noted that all 14 consents on trial X used the previous version of the informed consent form. And there were no other errors before that date. So that told me a lot of useful information. It told me when something happened, where it happened, what trial we were talking about. It bounded it in time, told me nothing happened before that. And it was very clear about the nature, the scope of how many of those informed consent forms, so 14 consents, were not using the current version. They were using, I would say, the previous version of the consent form. So that gives me a good starting point to conduct my investigation. Does that make sense?
Yeah, no, it does.
All right. So if I've got a nice, concise problem statement that stands on its own, the next step is to start investigating it, right? I mean, now I know I've now defined what is the problem I'm trying to solve, and now I go to solve it. Pretty straightforward. So remember, we got to do these 5 steps in order. So I'm not going to start my investigation until I've defined my problem statement, right? So now that I've defined my problem statement, I can start my investigation. Pretty straightforward. So that investigation builds from that problem statement, and I start to organize. I like to organize investigations into 3 buckets to keep my life simple, right? So people, process, tools. So the people bucket is, who's doing it? Do I have the right people doing it? Are they trained properly? Do they have the right background? Do I have enough of them doing this? Was it staffing? Was that my problem? I didn't have enough people, resources. So all of those things are my people elements. Then there's the process, which oftentimes for me is like the biggest one.
In terms of most common that you've seen?
Well, actually, that's a good question, or that's a good point. Most of the time, and we'll get into this in a few minutes, but most of the time, people like to call the cause of the problem human error, which would be a people problem. You say, oh, this broke because, Mike was asleep, right? But most of the time, it's not a human error problem. And I'll give you the secret tip to tell you how you can figure that out in a few minutes. But the process are really, I think, where the meat of these things happen. Oftentimes, what we think of as people problems or other problems are really process problems because they're ill-defined. So there's the process bucket. And then the last one is tools, which for me is like any kind of computer system or report or data or information that I'm using. So that's the tool bucket. So people, process, and tools. And I can then organize my thinking and understand who I'm going to interview, and understand which SOPs I'm going to read, and look at what computer systems they're using. All of that gets organized in as I'm starting to undertake my investigation. Does that make sense?
Yep. Oh, absolutely.
Now, you remember too, in the last episode, we talked about those definitions. They sounded similar, but they were pretty different. There was a correction, a corrective action, and a preventive action. Well, this is the step where you would typically start doing your corrections. So those things that, it fixes a past problem, but doesn't prevent the recurrence of that problem. You do that because there's nothing stopping you from certainly, fixing the thing that's broke, so long it doesn't tell you why it broke, so you can't necessarily prevent it from breaking again, but you can certainly clean up the mess from what broke the first time. So you undertake those corrections typically concurrently when you're doing your investigation, because there's nothing to stop you from doing that. Okay. So just like with the problem statement, there's some things you don't want to do in the investigation, right? You don't want to accept opinions as facts. You don't want to jump to conclusions too early, because that would be, presumptuous. We don't want to be presumptuous. We want to use all the information that we have. So we shouldn't just zero in on something and then exclude all the other information. So we should use all the facts that we were gathering through the investigation. And we want to make sure we go deep enough. And we'll get into this in the root cause analysis section next, but some people are just too superficial when they're looking at problems, and they do things like saying, it was human error. And really, if you dig a little deeper, you find that it's not. And another thing I see a lot are that people will get too sprawly in their investigation, and they don't confine it to the problem statement. So if your problem statement is defined well, it gives you really good limitations on what you're going to investigate. And that can really help you make sure that you get it done within a reasonable time frame. Most of these you need to present your CAPA and have it approved within 30 days. That's usually what happens. So you don't want to get this sprawling investigation that goes on and on and on. Does that make sense?
Yeah, no, absolutely. Time's ticking.
Right. So my big action for investigations is to bucket them. They build off the problem statement that we went over, but I like to bucket them into people, process, and tools. And that can help me to start thinking about how to organize and drill down in those various areas. And that's it. This is where the fun stuff begins. The root cause analysis. So this is our third and last section for this episode here. The root cause analysis is the mechanism or the methodology that we use to identify what the root cause is. So the whole reason we're doing an investigation, the whole reason that we're undertaking all of this activity is to identify what the root cause or causes are so that we can fix them. And so the goal of the root cause analysis is to identify one or more likely root causes. And at the end of this step, we should be able to clearly state that specific root cause or root causes.
I might be jumping ahead here, but in your experience, do you typically see usually confined to people, process, or tools, or more times than not, it's a combination of two or more of those buckets have a failure to equal CAPA?
Most of the time, for most of these CAPAs that we're going to be doing and focusing on, you're going to be able to identify just one root cause, and it'll be one of those three buckets. For some more complex problems, that's when you get into there are multiple root causes, but they should be distinct, right? So, because when it comes to fixing the problem, we'll get into in the next episode, you really need to be zeroing in and eliminating those root causes once you identify them. Most of the time, for most of the CAPAs that we're going to be looking at, and for the viewers who are learning about this, you're going to be doing fairly straightforward, narrow investigations that's about your area of work. So you're going to probably zero in on one root cause. Now, it's possible to do all this work and not find a root cause. That does happen. Hopefully it's rare, but it can happen for sure. And in those situations, here's a little tip. What you want to do is put in monitoring activity. If you can't eliminate the root cause, you at least want to monitor that situation so that when you do detect it, you can mitigate it quickly. So hopefully that's rare. I really like to get to a root cause, but sometimes it's not possible to do. So
Okay.
just putting that out there. There are a few different types of, or there's quite a few different types of root cause analyses that we can do. Things like, they have funny names like is not, and cause mapping, and Ishikawa, which I think means fishbone, although my Japanese is a little rusty. And the most common one that most viewers here are going to probably undertake is something called the 5 why. And I touched on this in the last episode, and this was like when you've got, your kids asking you why the ice cream is melting, it's why, daddy, why, daddy, why? It's the same kind of thing. So you're asking why 5 times, and we'll go into that, but, and you get to your root cause. And that method is good for 2 reasons. First, it's pretty simple because if your 5-year-old gets it, we should be able to do it. And it's also really good for very narrowly defined issues that we're trying to resolve, which most of these CAPAs will be.
I think I only usually give 3 whys to my daughter, so maybe I need to give her 5 whys to
Interesting. Yeah.
need to
Well,
count. I'll count with my hands next time. She might go to 50 if I let her, but
well, 5 is probably overkill. Sometimes you get to your root cause before the 5th why. There's nothing saying you can't do that either. But by 5, you should really be definitely there. And like I might have said in the last episode, I don't remember, each of those whys has to build on the last question. I'll give you an example in a sec, but those whys, you can't just ask 5 random why questions. Each subsequent why question needs to build off the answer of the previous one. I say obviously, but I've read a lot of these investigations, and I'm left scratching my head sometimes. But yeah, so, and that's one of the main pitfalls in the 5 why. We'll focus on that one for today, is not building off the previous one. Another thing I see a lot in these things is they state the problem statement that they've already done as the root cause of the problem. So after all that work, they end up just restating the problem statement. Like, so, I think I gave a case about, why did the person not sign the current informed consent form, right? That was sort of the problem statement we were just talking about. And the answer is that the wrong version was used. It's like, well, you're just restating the problem statement. So that doesn't work for me. So you can't restate the problem statement as the root cause. That's not allowed. And you shouldn't be using any information that you did not have in your investigation in your root cause either, because that just means you didn't follow the process. And you need to look beyond those human factors to determine the actual root cause. So when, I was saying earlier, this is time for that fun fact. The reason that this happened was because Mike was sleeping. That would be, in the parlance of CAPA, that would be called human error. So I will only accept a human error root cause under this condition. Are you ready?
ready.
Okay. If it's stated very specifically in the procedure what to do clearly and succinctly in my SOP, tells me what to do, and you as the person following the SOP do not do it. So if it's very clearly laid out in my procedure, do this step, then do this step, then do this step, and I didn't do them, then I could say, sure, that's human error. But if it's not, if it was ambiguous or, well, everybody knows I'm supposed to do it this way, I didn't write it that way in the SOP, it's probably a process problem. Then I need to update that procedure, train people on it, then implement it.
A whole nother episode, I'm sure, on
It is.
on the right depth of SOPs, to not be ambiguous, but not to be burdensome.
Right. So the last little thing I often see, which is kind of a pet peeve, is that people don't clearly state the root cause at the end of the root cause analysis. I want to hear, what actually is the problem, because that's a nice tee off to developing my CAPA. So I want somebody to say, yeah, the root cause of this situation is boom, 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 boom. And then I say, okay, good, I got my marching orders. So, so those are, that is sort of root cause. That's the 5 why of root cause. I can give you a quick example if you want.
Sure.
Okay. So remember that, being the GCP guy, there was the situation where there was a delay in consenting the 6 subjects at site X or whatever, and they didn't use the current ICF version. That's our problem statement. So the question is, well, why was there that delay? Why did that not happen? And so the first answer could be that, well, the investigator didn't consent them when they went to their visit. Well, why didn't the investigator consent them when they went into their follow-up visit? And because so that's your second question. Well, that's your second why question. Well, why didn't he do that? And it would be, well, maybe because all the subjects visited the site on the same day and they were all sent to the same investigator, and he didn't find any documentation telling him there was an updated consent form. Well, then why didn't the investigator learn that there was any updated information about reconsenting in the notes? That's my third why. And the answer to that question is, well, maybe the site coordinator used a sticky note to remind the investigator to consent the subjects, but it wasn't there when he went to look at the file. Well, why did that site coordinator use a sticky note? That would be the fourth why. And the answer to that is your root cause, saying, well, the site had no established guidance on good documentation practice. And so it led to this error where the investigator didn't know that there was an updated form for them to consent. So any subjects he saw that day didn't get it. And that's your root cause. Pretty easy.
Bingo.
So the next episode, we're going to take that root cause and turn it into a CAPA plan, and then we'll wrap it up with an effectiveness check. But today we talked about defining a good problem statement, and then undertaking and organizing your investigation, and then finally undertaking and completing your root cause analysis. So hopefully everybody got a little bit of value out of that, and we'll look forward to going to the next episode.
Awesome. Thanks for all the information as always, Leo. We look forward to speaking again soon on part 2. Thanks, everyone. Take care.